So welcome to the Menno Party, everybody. And Dr. Kat, we haven't had a chance to actually say hello face to face today. So hi.
Hello, how are you?
I'm great. I'm so excited to see you and to be
You too.
here and to introduce you to my Menno posse of incredible women. I want to introduce you all to Dr. Kat. So Dr. Kathleen Brown, I can call you by your full name, is a board certified OBGYN and also the medical director of Winona, which you've heard me talk about before. And I met Dr. Kat in person when we did a few events together in New York back in October, and we immediately hit it off and bonded over our passion for helping women on the menopause journey. And so I kind of shot my shot and I was like, hey, Dr. Kat, like, would you be willing to maybe come on and do a little chat with my people? Because everybody has so many questions about the menopause journey as far as pharmacology goes and all things hormone therapy and if it's safe for people and all kinds of stuff. So I am just so grateful that you're here. Thank you and welcome.
Thank you. Thank you so much for having me. Hi, ladies. Thanks for coming out tonight.
Yeah. This is always such a fun night. We just hang out for an hour, we talk, we answer questions, and it's very informal. It's very kind of back and forth. I do have a couple questions that some people who will be getting the replay tomorrow have emailed to me to ask you. But I thought to start off, you could start by just telling us a little bit about yourself, your journey. I know that you were in the military and you have an incredible story there and how you came to be in Philadelphia practicing medicine and
Sure.
what you're up to lately.
Sure. So I was actually born and raised in Philadelphia in the northwest section of the city in the Roxborough-Manayunk area. And kind of always knew I wanted to be a doctor. Went to medical school not too far at the Philadelphia College of Osteopathic Medicine, but I came from a family where no one had even gone to college before. So there was no path, there was no college fund. And so when I was in college, the ROTC was rappelling off our gym. And I thought, well, that looks like a fun class. Maybe I'll take that. So I joined the Army with the ROTC, and then the next thing they know, they were giving us applications for scholarships. And I was like, well, that would be great. That'd be great to be able to get some help for school. So I ended up getting a scholarship for the rest of college and then
Nice.
taking one for med school. And I stayed in Pennsylvania for college. I don't know if any of you have heard of it, but it's Shippensburg University, which is a tiny little state school in PA. And then came back to Philly for med school. But then as soon as I graduated, then I had to go on active duty. Since they pay for your education, once you get the degree that you intend, then they get their money's worth out of you and have you work for them to pay it off, basically, in your years of time. So I was active duty. I did my residency in the Army. So I was in Hawaii for that, which was fantastic. The furthest thing from Philadelphia that I could get. So I was there for 4 years. And then I've worked in Texas and North Carolina and back to Texas. And ultimately, it was through my own kind of personal chaos and journey that I ended up back in Philadelphia. I went through a divorce, became a single parent, and moved back to the Philadelphia area to be closer to family and friends and resources. But lately, I'm thinking I made the worst decision because it's so cold.
I hear you being an hour and a half north. It's just as cold
Yes.
here. It's miserable.
Did you guys
And
get a
I
lot of
have
snow?
two people who are we're supposed to be on the mental party tonight, but they're in New Orleans and they're getting such snow there. They've got like 9 inches of
Oh,
snow
oh,
in New Orleans
wow.
right now. Yeah, yeah.
That's crazy. They're not used to that for sure.
Definitely not. No.
No, 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 no. So yeah, and it was in my own journey of becoming an OB/GYN. Most of our career is focused on the OB part of the GYN, of focusing on delivering babies. There's my dog's going to join us.
Oh.
And not much emphasis or time is placed on midlife and women in midlife, especially, which kind of goes along with society, right? It's like not a lot of time and effort is put into us in that latter part of our life. But then when I started going through my own journey and started struggling with perimenopause is when I really started to take a deep dive because I was hitting roadblocks. I was not getting the help that I needed. Even as a board certified doc, talking doc to a colleague who was my doctor, not getting the care and the help that I needed. And I honestly felt kind of clueless. Even as a board certified OB, practicing for almost 20 years, when it happened to me, I was clueless. I really thought I was going to be fine until I turned 50. And I thought
Oh,
things were going to be good, good, good. And then 50 would come, and then I would start to notice things. But, it was one of those things that just kind of snuck up on me. And I really started to blame my perimenopausal symptoms on other things. I kept saying, well, it's stress, it's the divorce, it's changing jobs, it's this, it's that, it's, all these things. But then once you do the learning and you really look into what can happen and how these symptoms affect us, you realize it's all part of the spectrum, right? And so many things can happen to us in very subtle ways until we recognize what's actually happening in our bodies. So yeah, that's what really inspired me to kind of shift my focus. And as doctors, like we always have to be learning. It's part of our requirements that we have continuing medical education. But so much of what I'm doing now was so self-driven, because I was determined to find the answers for myself and then to help my patients as well. And then Winona kind of fell into my lap because our chief medical officer was looking to expand into the state of Pennsylvania. And we both worked for the same national OB company. And he just reached out and offered me a job doing telemedicine, taking care of patients in Pennsylvania. And so I started doing that, as I was also navigating my own journey. And it was fantastic to be able to help women that were going through the exact same thing that I was going through as well, which has
what
been
do you
great.
hear? I'm just curious, what do you hear on telemedicine that you might not hear in person? Like when do people come to you on telehealth versus IRL? Like,
Yeah, I think more often than not, the women who finally find us have been, doors have been closed in their face. They have not gotten answers. They've been told no. They haven't even been listened to. They've been told, they're not candidates to get help until after their periods are long and done. Um,
which is not true, by the way,
no.
which is not true.
Yeah. And I think more than anything, a lot of women are really frustrated because they're going to their doctors and talking to them about how they're feeling. And the only solutions they're being given are antidepressants,
Mhm.
birth control pills, which is another thing, that we can get into. So really, when you try to pour your heart out into someone and you're letting them know all these physical manifestations and symptoms that you're having, and they tell you, "Oh, are you feeling a little depressed? Here's some Prozac." Boy,
Right.
is that a slap in the face, isn't it? Because then it's basically them telling you, like, "Oh, it's all in your head. You're kind of crazy."
Right. Or this is normal for your age. You just have to ride it out.
Yeah. Yeah.
Hmm.
I think that that's the biggest difference. By the time they come to us, they are so desperate for help and care. They've gotten so many no's before they've reached us,
In a
unfortunately.
way, it's so tragic that that's what it is. But in another way, it's so great that they find you, that they find someone. And I I had not thought about telemedicine and going that route really until Winona reached out to me, full disclosure, and asked me about wanting to do a little partnership with them. And I had a OB appointment set up for like a month later, and I was like, yeah, I'll try it. I was going to ask him for HRT anyway. But now that I've met you, and now that I see how incredible you are and how much you care about your patients, I want everyone to know that the people on the other side of the line at a telehealth company like Winona or the other companies like Alloy or MIDI Health
Mhm.
they are board certified OBGYNs. They are qualified to administer this type of pharmacology for you. They are informed and they know what they're doing and know what they're talking about. And you are so compassionate and so smart. And I'm just really grateful to have your perspective on this call. And I think that many of the people who have registered for this event are also feeling that way. I hope so. I want to remind everyone that the chat is open. If you have a question, a burning question about anything, pop it into the chat and we will get to it because there is so much to talk about.
Mhm.
I would love to start by asking you, why does hormone therapy get such a bad rap? And what has changed? And we'll do the Reader's Digest version because a lot of people kind of know about the WHI and stuff. But for those who don't, what happened? Why was it? Why did it go the way it went? And what is the research saying now?
Yeah. So, yeah, before the WHI study, I think more women were readily given prescriptions for HRT, but there really wasn't a large repertoire of different medications and forms of medications that you could take.
It was
Um,
mostly synthetic, right? All like the
yes,
Premarin and all those.
mostly Premarin, Prempro, a lot of pill forms. They started to come out with some patch forms, but you didn't really know it. Like there wasn't really the option for topicals as much. There wasn't very much variety, and
Yeah.
there wasn't very much in the spectrum of dosage either. So when the WHI study came out, they were looking to do a large scale study to try to get more information. But then the problem was so much of it was put on the news, headlines, about certain aspects of the study and certain outcomes that they reached. But the problem was they were also giving HRT to patients that weren't great candidates to start HRT, like women over 65, women in their 70s. Um, and so they were giving high doses. They were giving it to an age group that we generally don't usually start. Usually that's well beyond after, you've gone through menopause. And we know now that the studies show that like if you start HRT after 60, there can be more risk to you starting it when you first start. So basically, WHI got a lot of notoriety. News channels were picking it up, and you still see this today. News in, eating chickpeas will cause this for your health. But then the next day, something else happens. But there were so many negative headlines coming out of the WHI that it really caused widespread panic and fear across the country. And all of a sudden, doctors started taking all their patients off HRT, women started stopping it. And this pendulum swung the other way, where it was thought, well, this is just too dangerous. It's too dangerous for women. We're not going to do it.
And the biggest danger they were saying was that it caused breast cancer, correct?
Breast cancer, yes.
Okay. Which
Yes.
has since been debunked,
Hmm.
and it does not cause breast cancer. Now, my question around that is when there is a type of breast cancer that is what's
Hormone
it? Uh,
receptive.
yes,
Yeah.
yeah. So can you talk about
Yeah.
that?
Yeah, so there's different types of cell lines that can cause cancer. And basically cancer, all the cancer is an overgrowth of cells. And so all of our cells are pre-programmed to do a certain role, to have a certain function. And when those cells outgrow their pre-programming and they overgrow and they take over blood supplies and they start invading the tissues around them, it becomes a cancer. So that
Mhm.
can happen anywhere in your body. But specifically with breast cancer, they can be responsive to hormones. So you can have breast cancers that are estrogen receptor positive, progesterone receptor positive. You might hear about other oncomarkers like HER2 and some other things that they look at the breast tissue when they take out a mass and they test it for receptor positivity, basically because that tells the oncologist how they can best treat you. So
Okay.
it doesn't necessarily mean that these cancers are formed and come from taking those hormones. It just means that they're going to respond to them. So, if you already have a cancer growing and you have excess of those hormones, then it can encourage the growth further, basically.
Okay. And so if your sister had breast cancer or your mother had breast cancer, that is not a contraindication, right? You can
No.
still take hormonal hormone therapy, menopausal hormone therapy if you have a family history of breast cancer. If
Yes.
you yourself have had breast cancer, that's another story, right?
That is another story. And that's really like once you get to that point where if you've had a personal cancer, you probably should have an in-person menopause specialist because telemedicine, we don't have the ability to do the same kind of surveillance and exams and really follow you as closely with physical symptoms through telemedicine. So telemedicine is really for low risk women.
Right.
Um, yeah. But yeah, if you have a family history, the only family history that really can preclude you from being able to be a candidate for HRT is if you got tested for one of the breast cancer genes.
Hmm.
So there are genes that, you may have heard of them in the news because I think Angelina Jolie chose to have a bilateral mastectomy because she carries these genes. So it's the BRCA1 and BRCA gene, BRCA2 gene, that if you have one of these breast and ovarian cancer genes, your risk for developing cancer so far exceeds the general population that it's just not
Wow.
the risk. Yeah. So in those cases, if someone's BRCA, we call it BRCA in the medical community, we try to make a word out of the acronym.
Yeah.
But basically, if you're BRCA positive, then you would not be a good candidate to start HRT through telemedicine for sure.
And what are the circumstances that you would know to test for that gene?
Well, so if you have family members that have had an early age of diagnosis of breast cancer, so, less than the age of 40, really less than 50 is concerning to us.
Hmm.
If you've had two first degree relatives that have gotten diagnosed young, or if you have another family member, typically if you get a breast cancer young, the oncologists are offering this genetic testing now as well. The hard part is, it puts a little wrinkle into things like applying for life insurance and benefits because now they're mapping all of our DNA and finding out about all these cancer genes. But then what does that mean for how risky it is to insure you, right? So a lot of people are worried about getting those tests done because will it affect their premiums? Will it affect them being able to get life insurance, things like that?
Wow.
But
Fascinating.
yeah, in fact, I did one of those genetic tests. You can do Ancestry or 23andMe and get your, genetic code because my mom was adopted and I wanted to find out like what nationality we were, not
Sure.
just what we were told by the adoption agency that she was adopted through. And actually, if you opt in for their research programs after you do one of those programs, anytime they have a new gene map, they offer you whether or not you want to have your DNA tested for it. So I got BRCA tested through that, and just to see if I carried the gene, which was great to be able to do that and to know that information.
That's a hot little tip there.
Yes.
It's a hot little
Yeah.
tip. Okay. Um,
Yeah.
we have some questions in the chat that because I think we're gonna have a lot of questions on this call. So if you don't mind, I'm just gonna roll. Is that
Let's jump
okay?
into it. Yeah, absolutely.
Okay. So Linda says one of the questions I have is how long I can expect to be on HRT.
Well, every woman's a little bit different. So, depending on when you start, like if you start in the perimenopause years before your period has actually finished, I would say the average woman is on HRT like 5 to 10 years, but every woman is different. So, whenever you feel like you want to trial off HRT, you can certainly try to go off of it. And then we see, how your symptoms do and how you respond. If you're doing well and you don't have a big transition period and it's not really disruptive to your life, then you could stay off of it. But honestly, I'll tell you, for the OBGYNs of us that are going through this and are aging ourselves, we joke, but we say you're going to have to pry the HRT out of our cold, dead hands because you feel so good on it. And when you see all the health benefits and all the positive things it can do for your body, it really makes you wonder, like, why would you stop? This is kind of like, to me, I kind of look at it like a supplement to my life now, rather than a medication.
For
Um,
real.
yeah, because to me, taking my HRT is promoting wellness for me, and I'm a much better version of myself on HRT than off, and I think my family would tell you that too.
And that's the thing. That's what I've heard as well. When as long as the benefits outweigh the risks, why
Right.
not stay on it? But there is a point where once is it 5 years post menopause, they don't advise starting HRT at that point if you've not been on it before. Is that
Yeah,
right?
it depends on how old you are when you go through menopause, but yeah, the real hard stop is someone that's more than 10 years from menopause. Because at that point, when you reinitiate HRT after your body has gone through this like weaning out of the estrogen in your system, especially after age 60 in particular, if you start HRT after age 60, for those first 2 years that you're on it, you can have an increased risk of cardiovascular events and heart disease just
Interesting.
because you're introducing the medication, there's some inflammatory response in the body. And we know that after age 60, that risk is higher. that risk goes down over time. And also, everything's mitigated with your lifestyle, right? So, if you know that that's a case, but you still want to start, then you fight that by eating healthy, exercising, staying active,
All
doing
the
all
things
the things
that I do.
to protect your cardiovascular life.
Right,
Yes,
right. Yes,
exactly.
yes. Awesome. Did that answer your question, Linda? I hope so. Karen, how long does it take before seeing a difference once starting HRT? I started, how do you say that, Bijuva in December.
Yeah, so I would say initially, most women will start to get some relief within the first few weeks of the vasomotor symptoms in particular. So, like your hot flashes, your night sweats initially might start improving initially. But some women can actually get worse hot flashes when they first start hormone therapy. As you're getting acclimated and the dose is getting in your system, it can take several weeks before that steady state of that dose gets to where we want it to be. And so as your body is trying to acclimate, there's a lot of highs and lows. That's when we know those symptoms are worse, is when there's big fluctuations in hormones. So once, you've been on it steadily for 3, 4 weeks, I think you'll start to notice the optimal benefits for those symptoms. Now, other symptoms like the joint pains, the brain fog, that can come next. Usually the vasomotor symptoms get relief first. And then the other parts that can happen, like, overall, body composition, weight changes, loss of the belly, that usually comes later, unfortunately. As human beings, we want those results like immediately, like yesterday. But usually the benefit of like the redistribution of our body composition, the no longer depositing fat in our midsection and getting that belly, that usually happens like at the 2 to 3 month mark that we start noticing changes with that.
And I actually just read, I'm doing a little reread of the new menopause, and I just read that there has been new research that came out that did say that taking menopausal hormone therapy does help reduce the likelihood that you'll gain visceral fat around the midsection. Is
Mhm.
that due to the anti-inflammatory effects?
Yeah, I think anti-inflammatory, but also decreasing stress levels and decreasing your cortisol levels is the other thing.
Right. It's both and, right? Because if you
Yeah.
are no longer having night sweats, then you're sleeping better. If you're sleeping better, then your cortisol and your melatonin are regulated. And if those are
Yes.
regulated, you're not feeling like you have to eat sugar. And if you're not eating sugar, you don't have to have the inflammation. And so it's all like a kind of a
Yes. I mean, when you think about it simplistically, like when we were cavemen, in fight or flight mode, you reserved all your calories and everything was saved. And so when you're in a stress state and when there's a lot of changes happening in your body doesn't want to expend any calorie. It's holding on to it just in case, you know. So
right.
it's nice to get beyond that.
Yeah. Hey, Karen, I want to ask you, are you feeling effects of your hormone therapy yet?
So it was exactly what Kat said. My hot flashes got so bad. Like I was on fire.
Oh,
Fire.
Mm.
Like it was bad. And now let's see. Well, how long have I been on it? I want to say since December 16th. So it's been a little over a month. I really haven't seen a difference yet. But I things take time, but that's why I wanted to ask because at first I was a little scared.
Yeah, it can be scary, but what I usually tell my patients, especially when they're going through that in the initial phase of starting a treatment, really try to optimize your water intake. Do
Yeah.
the best you can, like to improve your sleep hygiene, even if that entails taking something to help you sleep. I mean, I have no shame in my game. I take melatonin pretty regularly and give it to my kids after the pediatrician said it was okay.
Mhm.
Um, because there's just some times that we can't turn our brains off. Like we
Yeah.
can't wind down. And I don't know about you ladies, but usually the late night after everyone has gone to bed is when I do some of my best work when it's quiet in the house. And I don't have anybody messing with me. It's funny because as we've been talking, my daughter's been trying to pass me notes to ask for her electronics. Like you may have seen a little shark fin here. That was her pajamas. But yeah, like so late at night is when we have the free time to do things. But ultimately we have to really focus on our self-care. And unless you get that restorative sleep at night, unless you're really focusing on nutrition, it's harder for your body to adjust to the changes that the medication is trying to make too. So I think that that's usually what I tell patients to focus on.
Thank you.
Thank you
Yeah, I'm
so
looking
much.
forward to the brain fog going away because there's sometimes I'm sitting at work and I freeze.
Yeah.
It's a big problem. Like I have a very like a lot of multitasking and talking to people on Zoom meetings, and sometimes I lose my words a lot, and
Mhm.
it's very scary.
I
So
had
for
that
Yeah.
too,
that to
Karen.
like come back.
That was my main symptom was the brain
Yeah.
fog and it was debilitating. So I
Yes.
really understand how you feel and it will get better.
Thanks.
It
It's not
will,
only debilitating, but it's embarrassing. And then,
It's embarrassing.
yeah, yeah, we've been there.
for sure. Okay, Jamie says, how do I get my providers to listen to my needs? My situation is a little specific, 41, early in the process, but the hormonal changes are affecting my type 1 diabetes management.
Mm.
This may actually lead to my retinopathy getting worse, requiring monthly injections for treatment. I don't want that, but everyone just hand waves because hot flashes are minor and no other major changes or is it or blood sugar changes or other blood sugar changes?
Yeah. Well, the hardest part is getting the time and getting someone to listen in the scope of a short appointment. And I think honestly, the best thing that we can do as women is educate ourselves as much as possible. When you go into a doctor's appointment, bring data with you, like bring information. So whether that be a symptom tracker or, you can tell them people look for like qualitative information and quantitative information. And ultimately, when you have a 15-minute appointment with your doctor, like you have to hit it hard. Like, hi, my name is Jamie. I know you're dealing with my diabetes, but let's talk about this. This is what's bothering me right now. And if you keep getting shushed or you don't think that they're making time for it, don't be afraid to call them out on it. I think that we have to tell providers how we feel and that we feel like they're not hearing us, that they're not seeing it. And I have asked patients, ask your doctor, do they point blank, do they feel comfortable talking about this? Do they have the experience? And if they don't, ask them to refer you to someone who does. And if they don't have those resources, you can search for a menopause certified provider on the Menopause Society's website. There's a find a provider thing where you put in a zip code. Or you could also get complimentary care to your in-person care by a telemedicine company like ours. So we purely exist because of not enough doctors being around and being willing to treat patients. And so if you're hitting too many roadblocks, but say you love your family doctor or your OBGYN for everything else, they're fabulous people. They've delivered your babies or whatever they've helped you with. But if they can't help you with this one thing that is really pivotal in your life, it's kind of important. So don't be afraid to get the care you need elsewhere if need be.
Um, I forget what I was going to say. Never mind. Okay.
Brain fog. There we go. Blame it
Yeah,
on.
see, in action.
It happened.
Okay. Um, Jamie, did that help?
I tend to advocate for myself a lot, having had diabetes for a long time, plus being a healthcare provider and just not taking no for an answer. It's just frustrating because I've had multiple roadblock me. Well, are you having like vaginal dryness? No, but I'm going to have injections in my eyeballs. And I'm sorry for if I squicked everyone out and anyone out. I'm very sorry for that. But I am too, and I don't want that. Thank you.
Oh,
So
yeah, no. That would
Yeah.
be, oh, I see a shark. I see a
Yep.
little shark.
it just feels like everyone kind of just like, you're not far enough along.
Yeah, I got the same exact answer. I got the you're too young to be going through this. You don't know what you're talking about. Let me send you for hormone levels. That was the infamous answer. And hormone tests don't help us at all because
Thank
often,
you. I was just going to say, let's talk about that for a second.
yeah, I mean, we could be suffering on the daily with symptoms that are debilitating to our professional life, our home life, affecting our relationships. But then the day that they send us to get hormone labs, or the day you happen to get an appointment at Quest or LabCorp or whatever, the labs are normal, right? So then they have absolutely zero information. This is a problem, and this is a medical situation where symptoms should be driving your treatment, not a lab test. It's not like an iron level where you check and then you replete with iron supplementation. Our female hormones are in such flux and they alternate, they're released in a pulsatile fashion. So if you get your labs done in the morning compared to the night, or you had a big meal before, or you didn't, or you were fasting, so many things can affect those levels that they're really just not good information for us to be able to decipher what it is that you need. Whereas if somebody comes to me with 2 weeks of a calendar saying, for every day at this time, I'm getting night sweats, every day I'm having hot flashes, I'm getting brain fog this often, then that gives me so much more information to know how to treat somebody. So don't be afraid to like download a symptom tracker. We have a free one on our website that's in our resource page that you could also use. Um, I can send the link to you, Erica. And in
Great.
fact, actually, while we're
You can
talking,
put it in the chat if you
I
want.
can put it in the chat. Let me just pull it up.
Yeah,
Oh, yeah.
that's so great. Thank you.
Yeah.
Nat says, I'm not sure if this was addressed or not, but I went to my doc a few months ago for HRT and left with birth control. Is that the same thing? 10 years on the birth control pill seems so long.
Yeah. So birth control is not the same thing. And unfortunately, too many OBGYNs feel comfortable, and even family doctors feel more comfortable giving you birth control than actually talking about HRT because frankly, they've been prescribing birth control the majority of their career. And so they know it, they have a comfort level with it. But birth control hormones are synthetic hormones that are formulated to completely suppress your body's own um, pituitary access with the ovaries and to suppress your own ovulation and reproductive function. So that's how they work by giving you enough hormones so that your body is not creating the same amount on their own to suppress and to keep your ovary from releasing that egg. So think about that when you're menopausal and your hormone levels are low. Do you want to take a synthetic hormone that's going to suppress what your ovaries doing naturally in addition? So no, HRT would work better because we're giving your body back the hormones that it's no longer making in adequate amounts to bring you back to a level where your body can function better. So a lot of women get birth control just because it's easy. The doctor feels more comfortable prescribing it, but it's not the ideal treatment. It might help with some of the symptoms slightly, but overall, it's not going to get to the core of the problem, and it's not going to replace your estradiol levels.
So what if somebody has an IUD? What would a doctor do if, say, you already have an IUD in and you're not going to have it taken out yet, but you want hormone therapy? Is that something that you can do?
Yeah, absolutely. So there's various different types of IUDs. Like, so there's non-hormonal types of IUDs like the Paragard, or there's hormonal ones like the Mirena or Liletta. All the hormonal ones have progesterone embedded in them. So we use them for treatments for heavy periods, for painful periods, but also for contraception. But if you have a progesterone IUD, typically that progesterone is only released locally into the uterus. It keeps that lining thin. So honestly, it's kind of nice because if you're going to go on estrogen, anytime a woman goes on estrogen and has her uterus still in place, she needs to take progesterone with it. Estrogen has so many beneficial effects throughout the body, but the one negative thing it can do is it makes that lining of our uterus fluff up and get ready for a pregnancy, that estrogen level. So you need the progesterone to counterbalance that to keep the lining of the uterus thin. But if you already have a Mirena or a Liletta or Skyla, hormone embedded IUD, that's already doing that job for you. So in that sense, you would only need to take estrogen if you already have a progesterone IUD, because the progesterone IUD can provide you with the protection that you need.
Can I ask you a question about
Yeah.
I had an ablation in 2019. And I'm on a transdermal patch, a progesterone pill, and the DHEA.
Mhm.
So even if I've had several people comment on things of mine on social or in my email list and say they also have an ablation. And I just wanted to ask, I think I know the answer to this, but even if you have an ablation, you still need the progesterone, even though the lining of your uterus is basically cauterized from the inside out.
Yes, because it's cauterized on that surface, but we
Mm,
really don't know what lies beneath, right? So
got it.
you can still have active endometrial glands underneath the scar or underneath the scab of where it got burned. And so there's, endometrial ablations are great for a lot of women that need them for help with heavy periods. But the downside is when you have a problem or there's an abnormality, you're not going to experience the bleeding that would otherwise trigger somebody to know there's something wrong.
Oh,
Um,
fascinating.
because you have that kind of scab on the inside of the uterus. But because you can still have active endometrium, you still need the progesterone.
Got
As long
it.
as there's still that tissue there, it still has the potential to be naughty.
Yeah, I don't mind taking the progesterone, honestly. Okay. This is Linda. She says, I live in Southwest Nebraska where there are zero menopause specialists. I didn't realize there was telehealth out there. How can I initiate something like this? So my question for you, Dr. Cat, is does Winona have doctors in Nebraska? It's a state by state initiative, right?
Yes. So I don't know about Nebraska per se, but I could find out. The easiest thing to do, the easiest way to do this is to go to a telemedicine platform like ours, which is Winona.com, and you select your state and we'll tell you upfront whether or not we're in your state or not. Now, we personally don't take insurance. There are some other platforms that do. So if that's a rate limiting step, and you want to go through insurance, then you have to pick one that uses insurance. But we found that it's kind of a block to care because most insurances only have a certain formulary of medications they'll allow you to take. But let me see. I don't know if we're in Nebraska. Um, I'm actually on the
They do
website.
take FSA and HSA.
Yeah, we take the HSA and FSA cards, and I have had patients that are successful in, getting their medication reimbursed by submitting receipts to their insurance too.
Oh,
So
cool.
that's
That's
another
good to
thing.
know.
So if you get, a receipt that is itemized and it has like your diagnosis code on it, and, you can submit that to your insurance. All right,
Okay.
so let me go. I'm looking, you said Nebraska, right?
Yeah.
Yes, we're in Nebraska.
All right. You heard it here first, Linda.
Yeah.
When I send the replay, I'm going to be sending a code for 20% off your first month of prescription. So wait until you get my email tomorrow. Okay, Tammy. Hi, Tammy. We've been DMing. Tammy says, do cortisol levels play any role at all? The answer is yes, but I'll let Dr. Cat tell you how.
Yes. So when we're not sleeping well, when we're starting to have symptoms, when we're starting to get all these symptoms of perimenopause, our cortisol levels rise. And then what happens is it's like this constant fight or flight fight in our body where we're trying to get symptom control. The cortisol levels are still high, and we're fighting against that. The cortisol is what blocks us from being able to lose weight. Also can affect your sleep quality too, and maybe you're not getting the same restorative sleep that you've gotten before. But yes, everything that you can do to reduce stress levels, to reduce your cortisol levels naturally is so beneficial. But ultimately, starting treatment will ultimately help with those cortisol levels to go down too.
So, Tammy, I'm just going to jump ahead to your second comment, which says you have an appointment on Monday and you're terrified to bring it up, but you're so greatly affected by the symptoms right now. And as a single mom of a special needs 21-year-old, you need to be you. So, Dr. Cat, would you have any advice for Tammy?
Yeah, come with questions. Write down like the symptoms that are most bothersome to you. And don't be afraid to have a frank conversation. When you're going in and they ask you what is the reason for the appointment, like from that first MA taking your blood pressure, or someone doing the screening at their front desk, tell them like, I'm here to talk about my perimenopause symptoms or my menopause symptoms. Like I need to talk about options. So then that's written on your paper. The doctor sees that before they even come into the room. So then they can mentally prepare. So then you kind of know right off the bat when they come in the room, if they don't address what you brought in as your chief complaint and they completely try to go on off on a tangent and do something else, that's your first clue that they might not feel comfortable. But then ask them, say, okay, well, I made this appointment specifically because I wanted to talk about X, Y, and Z. Can we talk about that? See how they respond. If they say, nope, I'm not really into that. Okay, well then who would you refer me to? That is like, what resources do you have and who's in our area that I can go see if you're not comfortable,
And if they don't have anybody, that's when you go to menopause.org and you look up where you are and find somebody there.
Mhm.
Or reach out to me and I can help you find somebody if you can't.
2 years ago, when I saw him, they did an internal ultrasound and said, well, you're still producing follicles. You can still have babies. And I was like, I don't want babies at 47. That was 2 years ago. I said, I'm
Also, yeah,
good.
you can have babies all through perimenopause, but that doesn't mean that you
That's
can't be
great. Doesn't mean I
treated for
want
your
to.
suffering.
Right, but there you go. There is a perfect example about what does our worth mean to someone as women, right? Is our potential and our health only about our fertility? It's not. Like, but so much emphasis has been placed on that. And it's just not, it's not who we are in our total being, right? But
Definitely not.
that's society, unfortunately.
It's so true. It's so true. And it's not who we are as women. We don't have to suffer like this. We have so much to give and
Mhm.
so much to make the world go round because Lord knows we make the world go round. And
Yes.
we need a little help. And sometimes that help comes in the form of a little estrogen and progesterone, and sometimes DHEA, which is the next question.
Yeah.
Um, what's the deal with DHEA? I haven't heard about this yet. How is it different from other hormone therapy?
Well, so mainly DHEA is a supplement. It is a precursor hormone supplement. And when you take it, it breaks down in your body into estrogen and testosterone. So you'll see a lot of buzz right now about testosterone. A lot of the menopause docs that are doing education online and on Instagram are talking about testosterone. The big thing in the United States is testosterone is a controlled substance. It is widely abused and misused by the bodybuilding community,
By men, by
by
men.
men. Yes, they
Ruined
ruined
it
it
for
for us
us.
again. Um, and by the military, actually. I saw a huge amount of testosterone abuse in my time in the Army, mainly
Fascinating.
from like, special forces and rangers and these guys that have to like lift more load and run faster, perform more, lift higher.
Wow.
And then the downside was I learned about it because their wives weren't getting pregnant when they wanted to. Well, because these guys were pumping so much testosterone their testicles basically shriveled up. They weren't producing their own. And they became aspermic. They weren't even creating enough sperm because their testosterone levels were so suppressed by taking the exogenous supplement that their body wasn't functioning normally. So, because of that, it's treated like a controlled substance, meaning that it's treated like illegal drugs, narcotics. And so it's highly regulated. And the FDA, which is our Food and Drug Administration, which a lot of people give a lot of clout to medications that are FDA approved, but when they're FDA approved, all that means is that a big pharmaceutical company has paid a lot of money, they've done a lot of research, and they've gotten FDA approval for the medication. Anything that a company cannot make money off of, they will never get FDA approval. It's
I
not
did
something
not
that's
know
given for
that.
free. Right. So FDA approval is something that Big Pharma gets. So you'll never see like the world's best vitamin supplement get FDA approval because guess what? No one can make money off of it by doing the research and putting a patent on it. So anyway, it's not FDA approved for women. The testosterone is not. So right now, like when we're prescribing testosterone, it's off label, or we're giving it based on men's dosages that are available at the pharmacy, but we're having to, tailor that and fine tune it to women. The downside is through telemedicine, that's really difficult to do. So we discovered that using DHEA is a way to gently raise testosterone levels to the normal female levels without having to go through all those hoops and regulations, and to do it safely because it's a low dose. So there are some other companies out there that will prescribe testosterone. We don't, but an in-person menopause provider could as well. Um, so that's something that is an option out there. And when you think about it, a lot of women are like, why do I need testosterone? I'm a woman. Like, I don't really want to become more manly. But we have testosterone circulating in our bodies. Our body converts estrogens into testosterones and vice versa, back and forth. And so it's an integral hormone that really drives our libido. It can help with our muscle strength, our stamina. And so many things it can help with that when those levels get low, it can affect our ability to really function as well when we're exercising. And so it's something that can definitely improve with supplementation.
So how does taking DHEA, if you're taking estrogen, like a cream or a patch or something, and DHEA, is that factored into the dosage that you're prescribed because there is a
Yes.
little bit of extra estrogen going into you through the DHEA?
Yes. So yes, we have to make sure that we take that into account so that you're not getting too much estrogen for sure.
Okay. Okay. So Jacqueline, I think that just answered your question that I just saw you post in there.
And I finally found the link to the symptom tracker. So
Okay.
let's see. I got to figure out how to get to the chat button. There we go. All right. So here's the link for the symptom tracker. I
Thank
think it's
you.
printable or you can download the PDF. Um, and that's free. And if you just put in our website and put resources, we also have a lot of free education. I'll put this link there too.
Thank
Um,
you.
because we have webinars that we do on a monthly basis that are free to attend that you could sign up to attend. And that's usually Dr. Green and I and a moderator where we take live questions, kind of like we're doing tonight. But there's also printable FAQs. There's also articles you can read about menopause, perimenopause, any topic, and all that stuff is free to access, all those resources and educational things.
Thank you.
Yeah.
Melissa says, can you talk about moving from HRT via non-bioidentical pills versus patches and bioidentical treatments?
Mhm.
So from synthetic to plant-based, I guess.
Yeah, so it really is an easy transition. You don't have to do any kind of special weaning or anything like that. Typically, if you're going to start a bioidentical treatment, and honestly, some of the prescriptions you can get from your doctor in person that you can pick up at the pharmacy are actually bioidentical. So mainly it's bioidentical because it's the same structural formula of the hormone that our body was creating on its own. So as female women, we have three types of estrogens in our bodies. We have estradiol, we have estriol, and we have estrone. And so if you're taking estradiol or estriol, that means you're taking a bioidentical estrogen. But if you're switching from like a Premarin or Prempro and trying to switch to something else, literally when you're ready to make the transition, you would let your doctor know who's prescribing the bioidentical, what dose you were on, so they can find something comparable so that you don't have a huge fluctuation in your dosage. And you finish the one day, start the other one the next day. It really is not a difficult transition to do. But most women will find that when they're taking bioidentical, they tend to have less side effects, less ill effects from the medication, less nausea, less, GI upset, that kind of thing, even if they're taking pills.
Awesome. And speaking of different forms of hormone therapy, can you talk about if you have the choice to do a transdermal, like a patch versus a cream or something like that? Like, or is there an estrogen pill?
There is.
There is.
Yeah.
Um, what's the most beneficial, would you say? I have heard that if you are prone to blood clots, that you should do transdermal because it doesn't go through your system, like your liver, I guess.
Yes. Yes. So our clotting factors are produced in our liver. And so any medication that you're taking that has to go through the stomach, get broken down by the liver before getting to the intended tissues is being processed through the liver. So it could affect those. So generally transdermal is safer than oral, but really the best method of HRT is the one that you can incorporate into your life the best. So even though I'm a big fan of the patch, I use the patch. I have had some patients that say, absolutely not. Every time I put a Band-Aid on, I get a black ring of stickiness that stays forever. I don't want that. Or if they've had an issue with medical tapes getting their blood drawn and they've broken out in rashes. So if you've had issues with adhesives, it doesn't matter if I think it's a good method. If it's going to annoy you and cause you problems, not the best way for you. But generally, the transdermals allow us to use lower doses. And because what happens is the medication's absorbed directly through the skin, gets into the bloodstream, you don't have that first pass effect of having to go through the stomach and the liver processing before it gets to where it needs to be. So less risk of GI side effects as well when you're using
Awesome.
a transdermal. Yeah.
Great. Jacqueline says, I'm a 7.5-year breast cancer survivor. Yay! My
Awesome.
breast cancer was ER positive, and my doctors all agree no HRT for me. Any suggestions on alternative natural treatments other than HRT?
Well, so the one thing I want to tell you though, for your vaginal health and the genitourinary syndrome of menopause, even if you're a breast cancer survivor, vaginal estrogen, which is local estrogen only for the vagina, is safe. And so that's something that a lot of doctors, I think, are still like gatekeeping on. There's actually a great doctor that I follow on Instagram. Her name is Corinne Men. So I think it's called, her site is Dr. Men, OBGYN.
I love her. I
She's a
follow
breast
her
cancer
too.
survivor herself and a
Yes.
menopause provider. So she debunks a lot of the fears and talks about a lot of treatments that are options, for breast cancer survivors. She's wonderful and shares a lot of great information. But there are alternatives. I mean, there's other pharmaceutical alternatives that are non-hormonal. So right now, the newest one we have is the Veoza, which you may have seen the ads for. That one simply treats like hot flashes, night sweats, but it's very effective in doing so. It works on the brain and actually those thermoregulatory ways that those hot flashes are created. And so that's how it prevents them.
What's it called? Can you read what's the name of it?
Veoza,
It's Veozah.
H.
Yeah.
Then the other thing too is that even when we were back in the stages of being afraid to prescribe HRT, there's some other medications that we can use that can be really helpful with symptoms. One of them is called gabapentin or Neurontin, which is a nerve medication, also used as a seizure medication, chronic pain it's used for, but also it can be really helpful with insomnia for menopause and also can help with night sweats and hot flashes and body aches. Um, we also have used, there's a blood pressure medication that we traditionally use to help with hot flashes called clonidine, which is a really, really old blood pressure medication. And there are some SSRIs that have been used in the family of, like Prozac, specifically Effexor has been used to help with hot flashes and night sweats pretty successfully. They're not as effective as using HRT, but these are some helpful medications that can be used to do that.
Better
I think
safe.
I'm more interested in
More natural.
not so much a medication, but natural remedies. Yeah.
Yeah. So really
Yeah.
then, like there's some herbal supplements out there. The main
Mhm.
thing you're going to want to stay away from, especially if you're trying to stay away from estrogen related products, is make sure that anything you look at doesn't list phytoestrogens as an ingredient. Because even if there's plant estrogens, even in low amounts, that means there could be some estrogen-like compounds and isoflavones in the medication. So I've had patients take black cohosh, as an herbal supplement to help. I've had other patients take maca. I don't know if that's the same, if it's the right way you say it. It's an MACA.
Yeah, yeah.
Evening primrose oil has been used in OBGYN traditionally by midwives for years and years. And that's something that they recommend as a menopause supplement as well. But we also use it to help soften your cervix for labor, um, lots of different things. But the downside is there's not a lot of research out there on herbal supplements, and you won't find a lot of data. If you're looking into more natural supplements and things like that, just consider your source, see where you're getting it from. Like, obviously, if you're thinking about a supplement and it's like some Hollywood star selling it, if they're making money off of it, always take that into account. Do your own reading, make sure you're trusting the source of where you're getting something. And most often, if they make a ton of promises and it's going to be the fix all and cure all, take that with a grain of salt, because the more claims they make that it's going to be the be all do all, then it's usually a false claim, unfortunately.
I just want to go back to vaginal estrogen for a second and
Yeah.
say that there's a very big initiative going on right now to petition to remove the black box label
Mhm.
from topical vaginal estrogen because the FDA is really holding on to that old study that it causes cancer. It does not, and the label still says it causes all these horrific things. So, yeah, so definitely topical vaginal estrogen can also help with stress-related incontinence, UTIs, vaginal dryness. What else, Dr. Cat?
Loss of lubrication. I mean, ultimately, pelvic support too, because the vaginal tissues, as they become weaker and they lose estrogen, the support around our bladder can cause incontinence, when the tissues get thinner, with loss of estrogen. So vaginal estrogen can help with that. But mainly it's for keeping your sex life alive and well. Because as,
I'm
Yay.
good. I'm
okay,
good
good.
there. I'm no, I'm good.
Well, and the
Rub
big
it
thing
in,
I think
Jack. Rub it in.
Sorry.
yeah, if you don't use it, you lose it. That's the main thing. So the other thing that's very good for maintaining healthy tissue in the vagina is to continue having sex and to continue having more activity there. It helps to keep the tissues healthier. It's like
Good. I will.
exercising for that part of your body.
Love it. We love that.
Too.
What's Primal Queen? Jacqueline's on Primal Queen. She's been on it for a month. Um, she was recently prescribed an antidepressant and anxiety drug, and she doesn't want to take that. Um,
I'm not familiar with Primal Queen. I'm gonna have to look that up.
This is what it looks like. It's basically just a bunch of organs broken down into powder.
oh,
Oh,
is it like that yam or
oh,
the
it's royal beef organs.
Yeah, there's all kinds of organs in it.
Huh.
Which, I mean, I feed my dog organs all the time, and she goes bananas. Just the smell of it when I walk in with the grocery bags, like she can smell it. And I mean, I've heard my whole life, it's like, no, eat those organs, they're good for you. But I'm like, it's gross. I'm not eating those.
We'll have to look
So,
into that more. I don't know anything about that.
so
Yeah,
I just got the second package in the month today. So that's where I'm at with it.
so
Okay.
how do you feel so far taking it?
I mean, I think it's one of those things, it's too early to tell. But I'm pretty sure it's a 365-day refund policy. So I'm like, what's the worst that could happen?
Oh, that's a great refund policy.
It is. It is. Yeah. Yeah.
That's great. Well, let me
Other than that,
know. Please keep in touch and let me know how it goes.
okay, I will. I will. Yeah.
Yeah, I'm always looking for a hack.
Yeah.
Um,
If I can butt in as a dietitian, the usual concern with organs is over getting too many of those micronutrients, the vitamins and minerals. So just make sure you're not overdoing it and taking other supplements.
aha, thank you,
I mean, I
registered
take other
dietitian Jamie Kowatz.
supplements, but not organ related supplements.
But are you getting vitamin A or B12 or zinc or selenium or something like that? You might be getting too much.
I'll have to check.
All right, a
Well,
wealth
thank you.
of information. I want to just go real quick. Dr. Kat, do you have 5 more minutes?
I do. I do.
Okay. All
Yeah,
right.
no
If you guys
problem.
have to go, don't worry, you'll get the replay tomorrow. But I want to address a question from one of my snowed in ladies in New Orleans because I promised her I would. So she says, I am currently taking Activella and Vagifem in pill form. Are these synthetic? I still have a uterus.
I believe Vagifem is an estradiol pill.
Okay.
Um, so if it is, let me just double check because it's been a while since I've looked at Vagifem.
Is it like a vaginal estradiol?
It is. It's an estradiol vaginal insert. So this comes with like an applicator that kind of looks like a tampon applicator, and there's a tiny little pill in the top. So you stick the applicator in the vagina and you push the button and it puts the little pill in your vagina. So it's a nicer way to supplement with vaginal estrogen if you don't like dealing with creams, because with creams, what goes in must come out.
Yeah.
So like you put the cream in at night, it does its contact with the vagina all night, but then in the next morning you got to wear a liner and all the cream comes out. So it's kind of messy. I don't know about you ladies, but there's nothing worse than like a bad discharge. So
That's the worst.
yes, I'm not a big fan of like putting a bunch of cream in my vagina. So this is an alternative to that. But if you have a lot of dryness and a lot of symptoms in the vagina, sometimes the pill can be irritative just because it's not a cream and it's not soothing. So sometimes it can be irritating for some women. But it is one of the options that it is bioidentical because it's estradiol. And
Okay.
it is a big pharma, medication that you could get from your doctor. I think it's pretty expensive though.
Okay.
What was the other question?
She's on Activella as well.
Acapella.
You know what that is?
I'm going to tell you in just a second. Let me see. So, yeah, so this is an oral HRT and it has a synthetic progestin.
Okay.
So,
Yes, Anne Marie, that is a synthetic.
yes.
So what would the bioidentical version of that be?
So the main thing is if your Activella, it doesn't say on the site I'm looking at, it says it's a combination of estrogen and a progestin. But if it's a bioidentical progesterone, it should say progesterone, not progestin.
Got it.
The main difference. For the estrogen to be bioidentical, it needs to be estradiol, estrol, or estrone, but typically we don't prescribe estrone. That's the type of estrogen that's stored in our fat cells. So typically you'll see estradiol or estriol in a treatment form. So as long as it has one of those, that the estrogen component is bioidentical, but the
Okay.
progestin is not.
I have a question.
Mhm.
So if you've been on your HRT for a while, so I've been on mine like 7 or so months now, and you notice that some of your symptoms are coming back, like or you're developing new symptoms like joint pain or something that you didn't experience before, you're not sleeping as well again, or symptoms kind of return. Is it one of those things where you have to up the dosage sometimes? Is it normal
Sometimes.
to do that?
Yeah, as time goes on, and especially as we age and our ovaries themselves are changing their own production as time goes on, your dosage needs may change. However, depends on how frequently, like, and how much you've been noticing the change in symptoms. So I have patients all the time that'll write to me on our platform saying, I was doing great, but then all of a sudden, the last 2 weeks, I just can't seem to get on top of it. The hot flashes are back with a vengeance. My first question is like, what has changed in your life in the time period where you've noticed the increase in symptoms? I've had patients that post-COVID or post-flu, their thermoregulation is just completely thrown off. And your immune system is so activated after fighting such an infection that you're not quite back to baseline. So I usually try to encourage them to kind of give it a little bit more time. But I've also had patients tell me, well, actually, like I lost my job or I have this stressor or that thing going on. And it's amazing how much these things can affect our health. And it can cause a whole backlash of your symptoms to come back too. So, when those things are happening, definitely talk to your provider about it, whoever's prescribing for you, but also take a look inward, see like what has changed. Because ultimately, if we're taking medication and we're feeling great, we kind of bounce back into what we were doing, and maybe we might be doing too much, or maybe we need to reevaluate our lives, and see if there's another factor that could be, contributing. And often, if we take those out of the equation, then if you need a dose change, then you can do that and it can help you too. But a lot of times it's just a matter of getting, feeling better, getting more sleep, changing something about your lifestyle that could improve things too.
And I think this is a perfect way to wrap up this call is to say that hormone therapy can be such a game changer in your menopause journey, but it's not the end all be all answer. It
Yeah.
is both and. So if you are interested in hormone therapy, it's not going to solve all of your problems. You still have to do the work to get good nutrition, to keep moving your body, to get your heart rate up, to pick up weights, to have an anti-inflammatory diet, to decrease sugars and alcohol, and still and practice regular self-care and stress relieving tactics so that you can come at it from all angles. And I'm so grateful for this conversation. If any of you have any other questions, maybe we'll do this again in a couple months. I think that Dr. Kat, you are just so amazing, and you have been so generous with your time tonight, and I am completely grateful. And I know I'm going to get 1,000 emails when this is after the replay goes out and after tonight, because it is so refreshing to have an uber qualified, really cool woman, doctor who knows her shit to come in and say, this is okay. And this is how it works. And this is the answer. And here's when it's good. And here's when it's not good. And here's what you can do. And we're here to help you. So I am so grateful. Thank you so much. Um, and next month, this little teaser for next Menno Party, the special guest is going to be your husbands and partners, because we are inviting for Valentine's month your partners in to tell them what is up with what is going on with you in menopause and perimenopause. And I think that's going to be fun. So I'm hoping that we have a good turnout for that. But let's all thank Dr. Kat. Thank you so much. You're amazing. Visit her. I'm going to send you a code for Winona. If you're in Pennsylvania, maybe she'll be your doctor, which would be
Yeah.
so fun. I'm so jealous of everybody in Pennsylvania who gets
And I
Dr.
try to share some educational stuff on my own professional Instagram too. So that's at Dr. Kat OBGYN. And often I'll share some information from other OBs that I follow. But yeah, I think the big thing is knowledge is power, and we have to help ourselves, and we have to empower other women to do what they need for themselves. So, we need to change the dialogue so that, our daughters don't have to suffer and go through all the same battles that we are.
That is right. And on that note, thank you so much. Have a great night, everybody. I'll see you soon.
Good night, everyone.
Good night.